Like all other strains, Ebola Sudan is a serious disease with significant morbidity and mortality, according to health officials. Uganda Virus Research Institute states that Ebola Zaire and Sudan are more deadly compared to Ebola Bundibugyo.
The biggest number of deaths we have registered in Uganda in the year 2000 in Gulu was again Ebola Sudan.
But it is hard to tell the difference from the symptoms, as they are similar across most of the strains unless sequencing is done.
The differences between these viruses are in their genetic composition. If you look at their DNA or RNA, they are RNA viruses. But when you're doing your PCR, there are differences. You may need a different PCR for Ebola Zaire and a different PCR for Ebola Congo.
Uganda has had mostly Ebola Zaire and Sudan. According to the Uganda Virus Research Institute, the World Health Organization has approved vaccines from Merck and Johnson & Johnson to treat Ebola. The Merck vaccine is effective against Ebola Zaire, but it is not clear how effective Johnson & Johnson is against the Sudan variant.
There is no detailed study to show that it is effective against the Ebola Sudan. But because it has some components of Ebola Sudan, it gives us an indication that it may provide some benefit.
Uganda Virus Research Institute scientists from Makerere University and other countries are conducting research on the origin of Ebola.
One of the challenging areas that people need to know, where does Ebola hide? Which animals? Which is it in bats? Is it where? There's a lot of studies to find out where does it hide. The reservoir, what we call the reservoir.
Teams from Uganda Virus Research Institute and Ministry have traveled to Mubende district to assess the outbreak.
The PCR doesn't, a few hours, within 4 hours you should have the results. For the antibodies, if you have the samples around, it can be even shorter.
Nobat at Kunda, NTV News.